Good evening. My name is Shamika Rhymes, and welcome back to the fourth annual Healthy Kids Summit hosted by BlackDoctor.org. This summit is allowing us to focus on the health and well-being of children, especially as the school year is now underway, and to empower you as parents to ensure that your child is healthy. So tonight we are taking a look at a fundamental pillar of child health, building strong defenses, why vaccines matter. With so much misinformation circulating, it is more important than ever to get the facts from trusted experts. We will discuss everything from how vaccines work to addressing parental concerns and understanding their role in our communities. So make sure to share this with your network and drop any questions in the chat. And also let me know where you're watching from. And let me introduce you to tonight's panel. Dr. Christina Wells is here. She's a physician board certified in both family medicine and lifestyle medicine, and she specializes in both preventative health services and the management of chronic diseases with a holistic approach.
Good evening.
Hi, Dr. Wells. Welcome.
Thank you.
And then we've got Stacy Lee. She is a healthcare law professor at Johns Hopkins Carey Business School with a joint appointment at the Bloomberg School of Public Health. Let's welcome Stacy. Hi, Stacy. Thank you for joining us. Let's see. Well, let's start. Dr. Wells, why are vaccines such an important part of protecting children's health?
I think when we think about it, so when children are born and as they're growing, their immune systems aren't fully developed. And so, because their immune systems are not fully developed, that will make them more susceptible to illnesses. And so, vaccines are one part of the way that we help to develop that immune system to protect kids from diseases.
And I think that's part of the misinformation that's circulating because maybe people don't understand how vaccines work or what a vaccine is. Can you explain that a little bit?
So what a vaccine is that you are getting you're not getting sort of the disease. You're given a weakened version of, say, for instance, that virus or bacteria. You're giving a weakened version um, of a particle or a piece of that disease process. And so let's just say like a virus. So you're giving a weakened form of that virus or a piece of like of the viral cell or something like that that will be introduced into the body. And so when that is introduced in the body, we call that an antigen. The body will recognize it as something that is foreign, right? And so because it recognizes it as something that's foreign, it's going to start to build up a defense against that. And so what happens then when you encounter that virus later on, then your body has already recognized that, oh, I've seen this before and this isn't supposed to be here, but I've already started building up a defense. And so now I'm going to mount that defense and it'll be even stronger than if this were the first time that your body was seeing that foreign material.
Thank you for that explanation. So I'm sure both of you have heard a lot of different things. So, what are some of the most common myths or misconceptions about vaccines for kids? And then, what does science actually tell us? Who wants to go first?
I'll let Stacey go first.
Okay.
What's really interesting, and I will absolutely yield the floor to Dr. Wells for the medical side, but I think what's important is how important our government has recognized the need to protect kids in, and really encourage vaccines. So it is legally, the state is in the role of the police power, meaning, hey, you want to send your kids to public schools? You need to have vaccinated them so that they can be healthy, be protected. And when enough kids are vaccinated, you have that herd mentality that should there be one or two students that aren't vaccinated, they are protected. So it has been a just an embedded part of our educational system and the role of the state to really encourage and in some cases mandate vaccinations. And what we're beginning to see is states taking a different view of the importance of vaccinations. And I think what happened in Florida is one of the first cases that really kind of have turned the tide on, and really just goes back to some of these myths about vaccinations really getting a stronghold in people's minds, which really kind of defy the science that's out there.
Hmm. I'm sure social media taking that and running with it doesn't help those myths and misconceptions either. Yeah. Dr. Wells.
Yeah, I think a lot of things that I get in my clinical practice is that the vaccine will make me sick. And I think what we have to realize is that because the vaccine is going to introduce that weakened viral particle or a piece of that virus, that you might get minor symptoms, but you're not going to necessarily get the disease. The other thing that I will say, though, is that I think what we have to be clear about is what is the purpose of vaccines, right? The purpose of vaccines, you might get a mild illness with a vaccine. The purpose of the vaccine is to keep you from having a serious infection related to that illness. It's to keep you from being hospitalized, and it's to keep you from dying. And so it doesn't mean that you're going to necessarily not get sick. Some people, again, will have a mild reaction to the vaccine, but if it keeps you from having a more serious illness, that's really what the vaccine is about. And I think we don't always express that because people think, well, if I get vaccinated against the flu, then I should not get the flu. But your kids might get the flu. It means, though, that they're going to be less sick. They're not going to be for sick as long, and it's going to be less likely that they're going to get hospitalized related to getting the flu or have some other more serious outcome related to that. And I think if we really help people to understand that, then maybe that can also help people to understand the importance of getting vaccinated.
Well, that brings me to the next question, but how do vaccines, and you actually kind of answered it a little bit, but how do vaccines not only protect individual children, but also the community around them, whether it's at the school or in their home or the grocery store, wherever they're at?
Yeah, well, I know you mentioned it before, Stacey, about like this herd immunity. And so when individuals get vaccinated, then that will make it less, if enough people get vaccinated, then that could provide protection for others in the community. And so there is some credence to herd immunity. But I think the other thing you have to think about is that if enough people don't get vaccinated, then you really don't have that herd immunity. But it does, the more people who get vaccinated, it can be protective for those around them.
Okay. And actually, that was my next question, was about the herd immunity. Go ahead, Stacey.
I have a quick question, and I've seen recently autism being all over the headlines, and RFK Jr. has a lot to say about the causes of autism. And I heard just recently from a parent that vaccines cause autism. And I was wondering if you could dispel that myth.
I think that the causes of autism, and this is not the forum for that, but are multifactorial. And I will say this, though, there is no definitive data that states that vaccines cause autism.
Thank you. I was wondering the same thing because I remember celebrities have mentioned that, and they stood 10 toes down on that particular topic, saying that's why they didn't vaccinate their kids. So I'm glad that you just addressed that. What are some preventable diseases that can still pose threats if kids are not vaccinated? Dr. Wells.
Well, I think that we can think about things like measles, right? We see that there is a rise in more people, especially children, getting measles when we didn't really see a lot of that because kids were getting vaccinated. We don't see polio much in the United States, it's pretty much been eradicated since the introduction of vaccines. However, if you go to other places where other countries outside of the US where vaccinations may not be as readily accessible, then you might see other areas where polio still exists. So I think that we've been able to eradicate some diseases in the United States because of vaccinations, and even things like measles and things like whooping cough, pertussis, which is whooping cough. We've been able to eradicate some of these things, but we're seeing them on the rise a little bit more because of the decline, um, partially related to vaccines. I don't want to I mean, I think vaccines are really important. I also want to help people to understand that we're not saying that they're everything, right? That there are a lot of things that we do to prevent disease, but vaccines are a part of that overall comprehensive care in preventing illnesses.
I did want to just put an exclamation mark on that. 92% of the measles cases were in children that were, or individuals that were unvaccinated, and that we've had the highest spike in measles. There are over 1,400 confirmed cases across 42 states since 2000 when we had declared measles eliminated. So walking away or choosing not to vaccinate your children does have documented proof of really increasing the numbers and the danger that you're potentially exposing your child.
Mhm. Yeah.
Absolutely.
Thank you for sharing that. So what do you say to parents who they're watching and they're still like, I don't know, I'm still on the fence about the vaccinations because of side effects. What can you say to parents that are worried about side effects? Stacey, do you have any advice?
Of the side effects, again, and Christina put it so well, there may be a very mild case of the flu, but that is controllable. Or measles, your body is building up an immune system to that. Whereas if they get the full fledged virus with no protection, the downside is it's hard to compare the two. And I do wonder if the children who lost their lives because of the measles outbreak, if they had been vaccinated, would we have had the same result?
Mhm.
Yeah, I think that's an interesting point. Is helping one all the first place I start is trying to understand really what their concerns are. And, thinking about it, a mild illness, kids get sick all the time with mild illnesses. But as you were saying, Stacey, like, how would you feel your child is having this significant illness? It's going to cost you more days off of work, more days for that child to potentially be away from school, if they're school age, potential hospitalizations, right? And so the other side of a child getting significantly sick is and even in thinking about the potential that the child could lose their life, um, is really something that we want to consider. So I think really having those conversations in an empathetic way, but while also providing parents with enough information in a non-threatening way is important.
Mhm.
And I do think information is key. And sometimes you really have to question the sources or be curious about the sources of where they are getting their information from and what type of information that they would be open to. So, churches, other hospitals, doctors, trusted sources can be very good points to get real education across. And the conversation that we're having, I want to really be clear that, over 80% of Americans, despite the polarization of what you might hear, are strongly in favor of vaccinating children. And
Mhm.
I think we need to kind of address the concerns of the ones under the 80%, but we still firmly are in favor of protecting children against diseases that, if left without the vaccines, could have dire results.
right?
Absolutely.
Our most vulnerable people, children and the elderly are most vulnerable. And we want to do everything that we can to protect them. And again, not think that vaccines are the only thing, but they are an important part of that protection. And so we want to really do everything we can to protect the most vulnerable in our society.
Well, how can those parents that are still, again, on the fence and they're not sure, how can they talk to their pediatrician or healthcare provider if they're unsure about any of the vaccine recommendations? And I'm not sure how many, or if that's still a thing where you have to have so many vaccinations before you even start school. Um, what can those parents, what can they say to their healthcare provider to get more information?
I think one of the things you can do is just write down all your questions.
Hmm.
Down your questions before your visit so that in the visit, you're not having to remember what it was or feeling like you left without getting your questions answered. And then be open and honest. This is how I feel, this is what concerns me, and really let your healthcare clinician know that you want to be able to get the most up to date information as possible. Then also be willing to listen. And it should be a collaborative conversation so that parents can walk away feeling that they got all of their questions answered, and they have a better understanding of how vaccines work and why they're beneficial for their child.
Hmm. Do you have any advice, Stacy, or anything to add to that?
I think that everything Christina says makes so much sense. And I know that, not being a doctor, I know that there's a real disparity of knowledge between what Christina knows and what I know. So
Hmm.
I make a real point of going in with a list of open ended questions of, please explain this to me. What happens if I don't get a vaccine? What are the things that I could look at? And what's your data? Dr. Rose, you told me I need to get my kid vaccinated. Why? Can you show me some data or some research in a way that I can understand
Hmm.
that's going to counter what I've seen on social media or just what my natural skepticism of the healthcare environment is?
Absolutely. It reminds me, even, I had surgery this summer and I was seeing stuff on social media about the same type of surgery. I went in and I said, "This is what I saw. Can you please tell me, is this true? Will this happen?" All the questions. And so every time I saw something, I was in my chart asking a question. So I think it is important to, be able to speak to your provider and have that open and honest dialogue. And I want to remind everybody in the chat that if you have any questions, please feel free to drop it in there and we'll get to those. And since I just mentioned that, the being able to talk and have that open dialogue, what role does trust come, or what role does trust play in making those vaccination decisions, especially when parents are trying to decide if this is the right thing for their kids?
Yeah, I think that even though parents may look at things on the internet and social media, if they have a relationship with their child's healthcare provider, they
Mhm.
are going to look to that healthcare provider to be a trusted source. And I think
Mhm.
that's also important about how we as clinicians and providers address the issue of vaccines with parents. We have to address it in a way that is a welcoming conversation, so that we can always keep the door open, right?
Mhm.
While parents may not be ready today, if you keep that door open, you can always invite them back tomorrow to continue the conversation. And so I think that that's important because parents really do want to know what healthcare providers have to say. And if we can provide them with resources and additional information, even beyond things that we may not know immediately, I think that also helps to build trust. And sometimes being able to say, I don't know, but I'll go get the information for you is also important. I always want my parents to understand that it's not that I know everything, but I'll go find it out for you and I'll get back to you so that you know that I'm imperfect as well, but I'm going to do the very best that I can to make sure that I'm giving you the most up to date information that's available.
Mhm. And I'm sure parents appreciate that, because I would rather you tell me you don't know and go find out versus just throwing an answer at me that may or may not be right. I don't know how you feel about that, Stacey.
I think that in the times that we're in right now, well, first, parents want what's best for their children.
Right.
So, given that that's the base that we're starting with, that puts us on pretty solid footing.
Mhm.
I think that there are a lot of questions that people have about scientific data, about the government. So, it makes the relationship between the pediatrician and the parent all the more important. And if I trust and rely on you, because you can have, let's be really clear. The states mandate vaccinations. However, if I'm not buying into or trust that system, then I'm going to have questions. I don't sit down with my government official every day or at the beginning of the school year. I'm going to sit down with Christina. And if I trust her and I rely on her, then that's going to make me, okay, now I will do what the state has said. So, science, the laws, those are only effective if I believe and have a good relationship with my provider. So, unfortunately, not only do providers have caring for the patient on their plate, they now have kind of reestablishing trust that's been eroded in other areas.
Hmm. How has that been for you, Dr. Wells, trying to reestablish that trust? Or have you had that experience yet?
I haven't really had. I think I've tried to approach it where I'm always letting my patients know your best interest, your child's best interest is what's foremost on my mind. And I think that once I've established that, it's been easier
Mhm.
for me to be able to get this relationship where patients know that they can trust what I say. But if there are instances where it's shaky ground and maybe the patient may not know if they can trust, or when there was heightened, when people were really like, oh, you're just getting paid to say this or things like that,
Mhm.
you know I'm really honest with my patients, right? And I really take the time to help them to understand what my motives are, what I'm trying to do, and really have that open-ended conversation, and I think that really helps it.
That's good to hear. Are there any disparities in vaccine access among children in different communities? Stacy, do you have any data around that?
Yes, there are disparities based on race, ethnicity, poverty status, insurance status. So, yes, your zip code in many ways dictates the level of healthcare that you get. And that's true for vaccines as well.
Wow. Have you do you have anything to add to that, Dr. Wells, as far as disparities goes?
Yeah, we know that there are social and structural determinants of health, and those determine access to things that Stacy talked about, like um, transportation barriers, insurance barriers. I think a big part of it, though, and we're talking about that now, is literacy, right? And health literacy can be um, can be challenging in all types of communities. But in some communities, when you add other social and structural determinants of health, it can make that health literacy even more challenging. Um, and so I think that, and sometimes there's access to care, there's not always access to quality care. And so I think we have to think about those things as well. The type of care that you have, the type of relationship you have with your provider, how that provider views you and your family, all of those things are important to how access to vaccinations are going to occur.
So you mentioned the transportation issue, but like affordability and insurance, does that also impact whether or not a child is going to get vaccinated?
Yeah, I think for the most part, and I will say, like, I work at an FQHC, and so having the access in terms of affordability, most kids, especially in Illinois per se, have access to um, to vaccination. So it's really going to depend on, is that child signed up for things like Medicaid or CHIP? These are programs that offer vaccinations to children. So, and then also though, when you're thinking about it, where do I live? In terms of access, is there a clinic close by? Or do I have to travel 45 minutes? So then that's going to be a barrier. Even though I may have insurance, but if the clinic isn't close by, or maybe the hours aren't accessible for my mother or my father who has two jobs and other kids to take care of. And so that's why programs such as like mobile vans and vaccines in schools are important, because it really helps to mitigate some of these barriers to access to immunizations.
That's a good point. Stacy, did you want to add to that as well?
True. We love to talk about access to care. So,
Yeah.
yes, vaccines are available, but if they're clinic fees, if I have to take off work to take my kid to go get a vaccine, then that vaccine isn't free. So, all of these things go into the calculus of really access to care that aren't always talked about.
Hmm. Absolutely. Well, how can parents stay up to date on what vaccines their child needs and when? Because like I was mentioning before, there's the vaccines before you get to school, and then I don't. I'm just going on my own immunization card whenever before going to college and all those things. So, how can parents stay up to date on all of that stuff? Because it can be a lot sometimes. Dr. Wells, I'll start with you.
Yeah, it is. It is a lot. And what I would say is the best place is to ask your healthcare clinician. That's the best place to start. Start with your healthcare provider and ask them. They can always give you a vaccine schedule and spend some time helping you understand when's my child's next vaccines due. Usually, parents come in and I'll tell them this is when the next vaccines are due. And this is, or if it's a flu shot, this is when we're going to give a flu shot or a COVID shot or things like that. But that's the first place to start. I think that's probably the best place to start. There are other areas where you can go um, to get information, but I think starting with your healthcare provider is the best place.
Okay. Stacy, do you have any other ideas on how parents can stay up to date on the vaccines?
Well, absolutely. What Christina said makes the most sense. But I mean, you can go to the CDC, they have a schedule for you. There's ACIP, which is the Advisory Committee on Immunization Practices. I mean, if you want to, yes, you can go through all the regulatory and all those, but the easiest, fastest way is just to talk to your provider.
Hmm. That's simple. Yes. So as we wrap up, this conversation went by so fast, but as we wrap up, what message do you want to leave with parents about the importance of vaccines in raising healthy kids? Stacy, I'm going to start with you for this one.
A parent. And I do know that vaccines are one of the most safest, most effective tools to protect our kids. And not just from immediate illness, but from lifelong harm. So
Hmm.
the barriers to getting this in terms of how expensive healthcare can be, vaccines are really at the lower end, but the benefit that they provide over the life of your kid is just, to me, clearly outweighs any concerns. And if you do have concerns, talk to your healthcare provider.
Hmm. Great advice. Dr. Wells, how about you?
Yeah, I wholeheartedly agree with what Stacey said. I think that when we think about our children, we want to provide them the best. And we want to start thinking of care in terms of this holistic approach. When we think about a holistic approach, we want to think of what are all the tools in my toolbox that I can use to keep my child safe. And vaccines are in that toolbox.
Hmm.
There are things that we should regularly be thinking about and pulling out in order to help our children build a better immune system. And so I think thinking about it in that respect, and there are other things that we're going to do, like helping them to eat healthy and exercise. All those things are important, but they all go together. And when you put them together, they make for stronger, healthier children.
Agreed. Agreed. I was just checking to make sure I didn't miss anybody's questions in the chat. We did address what a vaccine is. That was a question. So I think we got it all. Well, I want to thank you both for taking time out to come and join us for our Healthy Kids Summit. This has been an amazing conversation. For more information on vaccinations, you can head to blackdoctor.org. There's plenty of articles and resources over there. And stay tuned for the next panel coming up. It's Unplug and Play, Finding Adventure Beyond the Couch. We're going to unplug those laptops, those computers, those tablets, all that, and find some adventure outside of our devices. So thank you again for joining me, and I will see you guys in the next panel. Have a good evening. I think we could just exit.
Well, thank you very much.
Thank you so much. Have a good one.
Thank you. Bye.